Hello my beautiful friends and welcome. I'm Inga, physiotherapist, and in this video we'll look how to treat your carpal tunnel syndrome. First we'll brush over the anatomy quickly, then I show you a quick self-assessment test that you can easily do at home, one massage technique, one stretch or floss of the median nerve, and then I show you a tendon glide that is really great to help you with your pain. So what is carpal tunnel syndrome? It's a common entrapment neuropathy of your median nerve as it travels through your carpal tunnel. It's causing tingling, pain or numbness sensation in your hand and fingers. So what is the carpal tunnel? The carpal tunnel is formed by your flexor retinaculum or your carpal ligament on top, and then on the bottom or the inferior border is formed by your carpal bones, so the bones of your hands. So you have the ligament and then you have the carpal bones at the bottom, and through the carpal tunnel run, for example, your median nerve and the tendons of 9 flexors of your forearm. If the tunnel is narrowing from the ligament, for example, but most commonly when the contents of the tunnel are swelling up, leading to a compression of the median nerve, we get the symptoms of a carpal tunnel syndrome. What does the median nerve do? We divide into sensory function and motor function. The sensory function is the innervation of your thumb, your index finger, your middle finger, and part of your ring finger on the palmar side, and the tips of these fingers on the other side. The motor function is the innervation of mostly the thenar muscle, so what you do with your thumb is often innervated by the thenar muscle. What are the common symptoms? The symptoms present as a tingling or like a pain or numbness sensation exactly where the median nerve would innervate. So your thumb, index finger, middle finger, and sometimes we see it on the side of the ring finger as well. Later on, you might feel something as of weakness in the thenar, but this is usually, as I said, in a later stage. And often we see that people are trying to shake their hands to relieve the symptoms. Plus, the symptoms often get worse at nighttime or when you are gripping something, for example, your phone or something similar. What are the common causes? The causes are often overuse. For example, if you're a lot on your phone, if you have a job typing a lot. It can also be caused by obesity, by pregnancy, or by some autoimmune disorders such as rheumatoid arthritis. What can we do, or what should we do for you to relieve your pain, is we should relieve the pressure on the median nerve. We should make the nerve and the tendons glide and move better. But first, let's start with a self-assessment test. The self-assessment test we're doing today is a Phalen's test. For that, you come into a reversed prayer position, so you put the back of your hands together like that, and then you're going to hold this position for about 30 seconds. And we're looking for a reproduction of the symptoms. So you're looking to increase or to worsen this tingling, this pain, this numbness sensation in your hand, okay? Another test you can do is a compression test. So you take 2 fingers and just press on the carpal tunnel for about 30 seconds again. And again, a positive sign would be a reproduction of symptoms. So a self-massage can help decrease the pressure of the tendons running through the carpal tunnel and thus decreasing the pressure that is put on your median nerve. So if you take, for example, your thumb and you're simply drawing circles on your forearm, on both sides, you can look for especially trigger points. Often here up on the elbow is a painful sore spot, and often here on the wrist you also find trigger points and painful spots. So once you found a spot, just make a few circles, put some light pressure on the trigger point, stay here for a moment until you feel the pain leaving a little bit, and then search for a new trigger point. You can also do a light traction of the wrist. So for that, you take your hand and grab your wrist and then simply pull it a little bit in that direction, okay? So pull it away from your forearm, relieving some of the pressure. Now we're going to do a nerve stretch of the median nerve with a little bit of a floss. For that, find yourself a spot on the wall or on a door. So you're simply placing your hand onto the wall, spreading your fingers as wide as you can. From here, you're going to turn your hand around as far as you can and press the hand towards the wall. You should feel a nice stretch of everything that runs through the carpal tunnel in your forearm, in your hand, maybe even up your arm, okay? Stay in this position if this is enough for you. If you want to take it a little bit further, we start with the floss by taking the head slightly away from the arm. Okay, so you're making this movement. You can also try to take it the other way and see how that feels. Okay, then release, shake out your hand a little bit and repeat. But be careful with your nerve. We don't want to aggravate it too much, but we do want to floss and move it a little bit. Okay, so the last thing I suggest you do is a tendon glide. Studies have shown that tendon glides improve how the tendons flow through the carpal tunnel. It's a series of 5 movements that you can repeat a couple of times a day. So the first step is that you bring your hand straight upwards. So the second position is a hook of the fingers. So you bring them in this position, and the third position is a fist with the fingers resting in that position. Then you bring the fingertips to a tabletop, and the last step is to make a fist or close this fist with the fingers straight. Okay? And then you repeat. So you hook, you make a fist, tabletop, fist, straight. Hook, fist, tabletop, fist. So you repeat this for 5 to 10 times, and you can do it twice or even 3 times a day. You should feel a gentle pull, but no pain. Okay, so there you have it. These are our quick tips for pain relief. I hope you enjoyed it. Don't forget to give us a thumbs up and subscribe to our channel. I hope you have a wonderful day. All the best to you, and see you here again soon.